last week we had a guest on our show. Her name is Dr. Kate Rayon Blue, and she's a doctor that wrote a book on vitamin K2 and the calcium paradox. Now, through her studies and her tests that she's done, this K2 is supposedly takes out the plaque in your arteries and also steers the calcium to the bone instead of to the arteries. Can you comment about that?
Sure. I mean, I've been taking 300 micrograms of vitamin K2 for years. I mean, for years. I mean, I actually met with the two Dutch researchers, one at Yale New Haven and one in New York City, they did 30 years of research on vitamin K2. It comes as, we call it MK4 and MK7. MK7, a metaquinone 7, is much more potent than MK4. And what these researchers, 30 years of research, Sal, PhD in vitamin K metabolism. I mean, think of that. Your life is on vitamin K. They showed me, this is like years ago, 6, 7 years ago, that people in the Rotterdam study in Holland, they did a large population study, and what it showed was that if people ate cheese, hard cheeses and soft cheeses with vitamin K2 in the cheese, that they had less aortic aneurysm, less heart attack, less cardiovascular events than the counterparts who did not eat cheese. This was like getting vitamin K2 in the diet. And then they worked on vitamin K2 in the animal model and the human model. I started using vitamin K2 when I wrote the book Reverse Heart Disease Now back in 2007, where we were using it for plaque reversal and plaque stabilization. So I firmly believe, and I was doing EBCT scans where we do electron beam computerized tomography. It's a CT scan of the heart. And I had patients who had more calcification in the heart, but after 300 micrograms of MK7, not 180, 150. I was using 150 for a while. I didn't get it when 150, but I had to double the dose. With a double dose MK7, I was getting regression of plaque in the coronaries. So I'm a big believer in it. I don't know if there's been a randomized clinical study on a large number of people. I think that's probably in the works. I know that Vermeers and Schergers, those are the two Dutch researchers that I actually met with eyeball to eyeball years ago, and I believe those studies are in progress right now.